Well, Delhi NCR's air pollution has been a grim reality. It's been a headline for days now. But one is slowly learning how India is dealing with an air crisis that isn't limited to one region alone. And now, for the first time, in fact, long-term data has also shown how deep and widespread the damage really is. A decade of unsafe air across major cities with barely any clean air days recorded. For 10 straight years, our biggest metros have lived in conditions that fail basic safety standards. Smog and haze are no longer winter events. They're year-round features across most states. The worst of it continues to sit over Delhi and the NCR, as we all know, but the geography of the entire Indo-Gangetic belt works against this region, traps emissions near the surface, locks the smog in place, and the load from vehicles, dust and industry makes the air stays hazardous for long stretches. Across cities, industrial clusters, construction dust, constant traffic add to this daily pile-up. Urban growth has shot ahead while the systems meant to control emissions haven't kept up. Weather has pushed the situation further this year. Weak western disturbances meant barely any rain, and without rain, nothing washed the pollutants out. Cold winds and stagnant conditions have stretched the smog episodes even longer. Even regions that once relied on clean mountain air aren't insulated anymore. You'd be shocked to know parts of Kashmir have seen unusual haze this season, with low wind and inversion trapping pollutants close to the ground. Doctors are warning that the impact is showing up in clinics, more breathing issues, more heart-related cases, and higher risks for children and seniors. The health cost is now a permanent part of this story. The long-term data is blunt. No major metro met safe air quality standards in any year of the study period. Cities that were considered better, like Mumbai, Chennai, Pune, even Bengaluru, repeatedly slipped below safe limits. Now, globally, the picture is no better for us. Indian metros dominate the list of world's most polluted urban centers, while cities in Europe, Japan, North America record cleaner spells through the year. Our urban clusters sit crowded in the high-risk zone. So this is no longer just a North India issue. It's a nationwide problem that needs long-term fixes. Are we really prepared to take decisions that will actually clean the air instead of just reacting to it? Let's bring in our expert voices this morning. First up, we're being joined by Professor Nomesh Bolia from IIT Delhi. He's with us. He's played a key role in research bodies looking at tackling air pollution over the years. Thank you so much for taking out the time, Professor. Good morning. We also have Sanjay Rana. He's the General Secretary of GK2 Welfare Association, right now in the midst of a legal battle against air pollution. Welcome, both of you. Thank you for taking out the time.
Thank you. Namaste.
Professor, if I can begin with you, you've spoken extensively on this one issue that no longer is an issue that's limited to, our study tables. It's an issue that we're looking at every day, we're dealing with every day, we're struggling with every day. When you look at this study, a 10-year study that has literally included all metropolitan cities, all urban centers, no longer limited to Delhi NCR alone, what's the first thought that comes with it? Of course, the threshold is different, the magnitude is different, but Pune, Chennai, never heard of, are showing worrying signs too.
Yeah, namaste. Thank you for inviting me again. The first thought that comes to my mind is we are not surprised at all. The signs were all there for a long, long time. I think we did not pay attention because, as it happens in public perception, you always tend to look for one or two specific cities, contexts, instances, and lose focus on the larger picture. I think that is what happened. There are experts in all dimensions. Air pollution is a multidisciplinary kind of a problem, right? So there are various people working at IIT Delhi and other IITs in all dimensions. And from what I know, none of us are surprised that this is what the study has yielded. And we can talk about the solution later, but this is the first thought that comes to my mind.
Okay. I do want to go across to now Mr. Sanjay. Mr. Sanjay, tell us a little bit about the legal battle that you're waging at the moment as we speak. There's a directive that's coming from the Delhi High Court asking you to take your plea to the Supreme Court. Has that happened as yet? Tell us a little bit about where you stand as of now legally here.
Actually, this issue of air pollution has been raised by many residents and who have been suffering from this pollution and have been hospitalized and things like that. So, considering our residents' plea. So we took up the matter and we approached the High Court for immediate action as per specific authorities are concerned for Delhi itself. And the High Court has taken up the matter and asked us to approach the Supreme Court for clarification whether the matter should be taken in Supreme Court or whether the Supreme Court directs them to take it up in High Court. So the matter we have approached, we have again filed for our appearance in the Supreme Court. The matter is listed on 10th, I think. So we'll be appearing in that matter.
Mr. Rana, also tell us a little bit
Yes.
about the observation. What compelled you to take this up? Of course, you are the General Secretary of GK2 Welfare Association. So in that capacity, it's incumbent upon you to take this cause for the people residing there. But apart from that, what are the observations you've made in your community? Talk about schools, talk about outdoor activities, talk about market areas. What's been your first observation, which has been very worrying for you personally?
Actually, the main is primarily the health concern of the residents, and it's pollution all over. AQI going up to 555 the day we had to approach to the court, and it was practically you can't even breathe properly. So every household has got a air purifier. And that too also doesn't work properly. The young newborns are approaching the hospitals. The elderly are approaching the hospitals. I have taken so many people to the hospital myself, and they are still hospitalized. So this AQI of Delhi is really worrying, and basically not good for any section of the society. So government should take primarily. It should be responsibility of all the organizations like MCD, Delhi government, and all. So to look into this and take it up on a very war footing, and this has been a consistent problem not only this year but every year around this phase in these months, every year. So this problem is there. So it's basically everybody is getting affected. Yes.
Professor Bolia, now we're looking at this problem, of course, be extremely worrying in the northern belt. That's where Delhi NCR comes into picture. That's why we're seeing what we're seeing all around us. The situation is not very different in other parts of the country. Of course, they're looking at moderate AQI, but a lot of Mumbaikars, for instance, say that what they've been witnessing the last 4-5 years is something that they'd never ever seen. A lot of geographical factors do play a role, wind factors do play a role, but tell us a little bit about local emission factors. And have you seen that trend change over the last 10 years, if at all?
So many studies come up with, use different methods and come up with their own findings. So while the trends would change, broadly, the source of emissions do remain the same, I think, very broadly. For example, vehicles, dust, industry, these three factors, and construction, they always play a role, as I can see flashing, things flashing out here. Delhi specifically also faces the issue of stubble burning, but that may not be all year round. Right? That's only for limited time, and maybe there is not much we can actually do about it, apart from usual monitoring and one or two things that we do have in mind. But apart from that, I think these factors do tend to remain constant. Maybe the composition of each one of them does change from area to area and time to time. But we do know broadly this is what the sort of set of sources is. And we also, interestingly, do know what we can do about some of them. And whenever you come to me about the solution part, we can talk about what we think the overall approach should be.
Yeah.
The big sense that we have is that this really is not, at least to begin with, super rocket science where we absolutely don't even have a starting point. That is not there for sure.
And do you think we've reached the starting point as yet, or we're far away from the starting point itself? Because up until now, till last year, remember, a lot was being spoken of, or the blame was being pinned totally onto stubble burning in neighbouring states. Now, a lot of studies have come out to show that how there's been a reduction of at least over 15% in crop burning if compared to 2024. If that stands ruled out too, there are other factors that need to be looked at.
Correct. No, absolutely. And there are other factors, and previous studies also did talk about these other factors. And even when stubble burning was in public perception being made out a big reason, which it probably was at that point of time, maybe even now, it would not cross more than 30-40%, right? I mean, there were still other sources that were, at least more than the stubble burning factor itself. About whether we have started that thing or not, well, so we did the study which looks at air pollution and how major cities in the world have handled it. They've been worse, than ours in time starting from 1960s onward. And I think what our finding was, when we made this report as a part of a center at IIT Delhi, was that one thing stands out, that there is no magic wand. You cannot just, weave it and suddenly the pollution problem will solve, right? And I was very, very happy to see the CJI, as well as recently the Chief Minister of Delhi saying the same thing. What that also means is that if there is no magic wand, you will not be able to suddenly come up with some kind of a technology, some product, some major thing and expect that the air pollution problem will go away. That's not going to happen. I think that realization has not kicked in. To me, it seems we are still looking for that magical solution. Let's seed the clouds and have rain.
But Beijing did not have a magical solution. They came out with a 5-year action plan and we've seen the results over 10 years. Why are we not in a different position today?
Exactly, yeah. So that's what we've been saying, is that we need to stop looking for these magical answers and make our own solution. And that will be painstaking. I think in a country like ours with, so much of, not chaos, but, noise around all kinds of things, right? It becomes difficult to sort of put focus on a plan that you make. People will raise all kinds of noises and all kinds of, irritants will come, many factors will come in. But there needs to be somebody, some agency that keeps its head straight, right? And focuses just on what the plan is and keeps on looking at nuances of why the particular thing that we have talked about is not working. I'll give you an example. So we've been talking about dust as a major source, right? Now we do know that what needs to be done for dust is regular cleaning. But so far, I don't see an effort that is really trying to look into details of why, despite the efforts that we have made, it is not working out as we want to be. Yeah? There could be various things. Maybe they understand. Maybe there is a plan about how the vehicles would move, cleaning the dust. Maybe there is something about how the broom itself is touching the ground or not. Maybe there is something about we simply don't have enough resources for these vehicles to move around in all sorts of areas that matter. These details is what I find missing. Unless we are willing to launch into these details, I think we will not be able to get there. One last thing that I had to add here before we move on to other things is, our sort of entire focus tends to be on looking at the AQI numbers and getting worried by it. I think we need to change our approach a little bit. In the long run, we need to make sure that emissions simply don't come. We minimize the emissions through a variety of policies, factors, technologies. We can talk about that now. But in the short run, right now, right here, I think we need to be able to figure out strategies that minimize exposure, of these PM the particulate matter, which is the main worrying cause. And how do you do that? So you look at what the major issues are, you identify what the hotspots are, right? The big areas, and then you focus on them. Instead of trying to look at the entire city and somehow magically bringing down the AQI of the entire city and things like that. So this painstaking approach of identifying the problem and painstakingly one by one strategizing on the elements and keeping on delving into nuances is something that I think is missing. In that sense, we may not have started our first step towards what the other cities might have done.
Which also means a lot of changes at the policy level that are needed, and that's where the biggest challenge comes into play. So we'll come to you for an answer on that, and we really want to understand what those solutions can be, because we keep talking about the problem, but where do the solutions lie? Speaking of solutions, Mr. Rana, being the General Secretary of your welfare association, tell us if at all citizen groups or resident welfare associations have taken up any such initiatives to, at least at their own level, ensure that there is some sort of reduction or they're able to successfully tackle air pollution. Has that happened, sir? If yes, how?
See, as an association, probably what we are doing is we have our own sanitation team, which we have employed over years. I think I remember almost maybe around 10 years from now, we have been cleaning our back lanes from our RWF funds, which primarily the role of the MCD, but we have taken the responsibility on us. Probably we are the only one of the associations doing all that. So it is so many activities like that. So we keep continuing in our area. This sanitation is one of them, and even tree pruning, we help the government organizations with the process. So we work in sync with the authorities, but I think there's a bigger vision required to do better things. So everything is doable. I think the vision should be larger.
And what impact on public health have you witnessed? You spoke briefly about it, Mr. Rana, but of your personal interactions, when you interact with family members, are senior members of families not stepping outdoors, are parents reporting of more cases of asthma in their children? What are those interactions telling you?
So basically, like some of our team members only there, he has a newborn child, so they have a issue with the health because of air. His grandmother has an issue, she is around 80 plus, they are all getting hospitalized. So many residents are getting hospitalized. Even for that matter, I was out of the country. The day I came back, suddenly I had a shock of this air pollution. So this is, I think, even if countries like China, Beijing and these Japan and Singapore can do it, why can't we? We are equally competent of doing anything. Maybe if the state lacks some resources or something, the center could get into all this, and this is the capital of the country, and we should be doing best possible. Should be the sample model of the country. So I think we should be, as Indore is rated number 1, so we should be in that category of cleanliness and air and all. And even these dust pollutions, all basically primarily we still following the old method of cleaning, brooms and all. So we should be having some vacuum cleaners, suction, all latest technology should be incorporated in the system. These things might help, and these are small steps which maybe it will not happen in a day, but over the years things can improve. Yes.
Over the years, a lot of promises have been made and a lot of promises have remained unfulfilled, and that's where so much anger is coming from. We've seen Delhiites take to streets, stage protests, but that doesn't seem to be working out still. Professor Bolia, do you think there's also a sense in the Northern Belt, Delhi NCR, all of these polluted cities, of the administration, the officials somewhere giving themselves an excuse that this is where we're placed geographically, and so entirely they're pinning the blame onto that? So with Bombay having as many cars, it's a populated urban center, same story gets repeated in Bengaluru and the national capital. Is that one excuse you think that we're giving ourselves, that because unfortunately we're in this belt which is a bowl-like belt, wherein because of a spike in winter we see air pollutants get trapped organically, we're not going to be able to do anything? Do you think that's an unfortunate excuse we're looking at? I think you're on mute, Professor Bolia.
Yeah, I'm sorry. Whether they're looking at it as an excuse or not, only they can know, right? We will not really know. But, this thing about being in an unfortunate geographical area, indeed is true, right? Part of that is true. But what my sense on this is that given that we are in this difficult area, we need to be even more alert and have even a more sense of urgency to tackle this problem. And that urgency should be high enough that it constantly goads us to, make a plan and keep executing it, keep getting into details. That probably has not happened. If they are doing it, at least it's not there in the public domain. So I don't think it's an excuse. I think, like the CM also recently pointed out, they have a large city to run. And if drastic measures are taken suddenly, no citizen is going to like that either, right? So I think it's not an excuse, but I think that sense of urgency, it seems has not kicked in yet, to the extent that it will force everybody to look at it in a very, very detailed kind of a way, and not look for a magical solution. See, when you have an urgency, right? Somebody falls sick, right? The only thing that you do when somebody, for example, unfortunately, God forbid, doesn't happen to anybody, is somebody your close family is admitted in a hospital. You don't expect that somehow only a magical doctor will come and solve the problem. Yeah. Of course, that keeps on happening, but everybody tries to do their job. Every hour, everybody is trying to figure out what is it that we can do continuously, right? It goads us into action. That sense of urgency probably has not yet kicked in. which should have kicked in given that it is such a difficult situation. So we'll have to be more alert and we'll have to be on our toes all the time as compared to the others.
Speaking of solutions, if you, Professor Bolia, could choose, let's say, 3 policy changes that could move the needle in, let's say, 12 months, what are they?
Yeah, so, well, thank you for coming to that point. I exactly have 3 points, actually. Not all of them relate to policy. The first one is, something that we can definitely do is tackling the dust problem, right? We need to look at details of why that is not working. Do we not have enough vehicles? Are we going to the right places? Is the vehicle working fine? It may or may not have the broom. Please don't get me wrong. We may not be using the old technology, right? But is it really doing the job properly? For tackling dust, there is also a water sprinkling solution. Are we looking at those solutions? Some colleagues of ours have developed that solution. Can we look at it in detail and actually deploy it? Because in our lab kind of settings, it seems to be working, right? So that is one. I think dust is one thing that we can handle, but that will happen only when we try to get into details. A superficial look or constantly feeling that, we are doing our job may not help. That is one. Second, I think is, before expecting people to do anything, the government, I think, really needs to convey that they are dead serious about tackling this problem, right? So there have to be various ways. Sudden instances of policies emerging is what citizens definitely don't like. So one fine day you introduce odd even, one fine day you ban crackers, one fine day you ban something else. Those knee-jerk kind of reactions may or may not help, right? So it might be needed. But then before that, I think my sense is the government should convey that we do really care and we are doing what we can possibly do. For example, we've been talking about EVs for a long, long time, right? But we still do not see more EV buses than diesel or CNG buses, right? So why is that the case? I think that is an implementation problem. If citizens also have to start using their EVs, there needs to be enough chargers, that entire ecosystem needs to be set up, which frankly we are not ready yet, right? So a typical Delhiite will still want to have an ICE vehicle, internal combustion engine vehicle, rather than an EV vehicle, simply because there aren't enough chargers, right, when you go around. So I think this, a clear administrative will, which is what China and Japan, by the way, demonstrated, right, very, very clearly, to indicate that, look, we are serious about this. For example, if the next 1 or 2 years, the government decides that we will do enough so that do it properly, systematically, and there are many more chargers than we have right now, and there are more electric buses than CNG buses in the city. Can we keep that as a target? That should be visible to the people. Second, once we do these 2 things, then we ask people to do other things, right? So reduce the use of vehicles, start taking public transport, create that environment where people feel that the government cares, and therefore, just like Mr. Rana just said, it is not just small things that we are doing that will make an impact. Somebody is looking at the larger picture, and therefore we should be doing our bit. When that environment is created, then the last point of citizen participation will be helpful. So 3 things: dust, get rid of arbitrary policies, show the intent, and third, then call to the people to sort of do their bit.
And once all of these measures are initiated, micromanaging or assessing at every level, I think, is the need of the hour, and that needs to be followed up with as much vigor. Thank you so much, both you gentlemen. What's worrying, if we just go by this 10-year study, is that this no longer seems to be a North India winter problem, seems to be an all-year crisis, and it goes much beyond North India, and that's why we thought it's important to just bring this conversation to the table. Thank you, both of you, for joining us this morning with your individual insights. For now,